Hi everyone, it's Dr. Star Ramson. I am receiving a lot of questions from concerned patients about whether or not they need to be concerned for their own health or the health of their families for contracting COVID-19. So I wanted to review what are the severe symptoms that are seen as we are progressing toward pneumonia in this condition, and what are the potential outcomes that we need to be aware of. So let's get started. Severe disease in COVID-19 involves a pneumonia where fluid accumulates in the lung tissue, and that fluid in the lungs interferes with the ability to oxygenate the blood. And this is due to a number of factors in this condition, but I've covered a few of them in previous videos. We see a massive inflammatory response to the disease. As the immune system is fighting the virus, a lot of inflammation is generated in these small areas of the lungs, and this leads to something known as acute respiratory distress syndrome. So the lung sacs have filled with fluid and cell debris, and they are no longer able to do their job of exchanging gases, and the patient is unable to breathe on their own without the addition of mechanical ventilation in the hospital. Of course, the acute consequence of this is needing that mechanical ventilation, but the long-term consequence is the potential for scarring and long-term damage in the lung tissue. We are also seeing the development of multiple organ failure in this disease, and this is due to the fact that the virus is able to infect multiple different organs, including the heart and the kidneys. So what are the symptoms of progression to severe disease? The main symptom we are looking at is shortness of breath. Shortness of breath indicates that the body is craving oxygen. And so that's the reported symptom that you are looking for. Signs that may be observed by your provider or that you could keep an eye on for yourself include an increase in your respirations. So normally we breathe about 12 times per minute, but in this condition, because there's a difficulty oxygenating the blood, the patient is breathing around 30 times per minute. There may also be an impairment of the ability to oxygenate, and so we see low oxygen saturation of the blood. This is monitored via a pulse oximeter, which yes, you can purchase. So how many patients out of all the patients that will contract COVID-19 will develop these severe symptoms? It turns out it's about 20% of the patients, and that is even further differentiated into those that develop very severe disease, but then those that become critical and may end up dying. So in this chart, which was taken from a study in China, showed that only 2% of the cases had died out of those that they had monitored in this study, but that out of the 20%, 14% were severe, meaning they still required hospitalization and ventilation, but only 5% became critical, meaning that they were developing to respiratory failure and multiple organ damage. What are the risk factors for developing severe disease? So it's age groups above 50, patients with comorbidities, meaning having these chronic conditions including hypertension, diabetes, coronary heart disease, and malignancy. And in this study, most of the fatal cases actually had 2 or even 3 of these comorbidities. Males are disproportionately affected more than females, and patients that presented to the hospital with low or no fever tended to have worse outcomes, and as well as smokers tended to have worse outcomes. So if you are local to San Diego, here are some of the resources that we have at our disposal if we are experiencing symptoms. What they are recommending in California is not to present to urgent care or the emergency room if you're having symptoms, but first to call a nurse's hotline. This is the number for the UCSD nurses hotline. They're open 7 days a week from 8 to 5 p.m. And once you speak with the nurse, they will then decide if it is indicated to have a video visit with a UCSD provider and then to schedule a drive-up test. So you actually drive up to the location, they instruct you where to park, and they do the nasal swab in your car. So these are some of the resources for you to look at. I hope this has shed some light on those of us who are at risk for developing severe symptoms with this condition, and also giving us some guidance for what we should be looking out for if we do develop symptoms. Thank you so much for joining me. Be well.